The National Center for Mental Health has reported an increase in calls to their crisis hotline amid the imposed lockdown in the country. Callers range from repatriated overseas Filipino workers to even medical frontliners, all under tremendous stress due to the pandemic. Mean Los Baños with the details.
Before the country was placed under community quarantine due to COVID-19, the National Center for Mental Health receives 60 to 80 calls from their hotline every month. These callers sought consultation for various mental health issues. But when restrictions were enforced, the NCMH crisis hotline was bombarded with 300 to 400 calls, an indication that more Filipinos are suffering from mental health problems amid the health crisis.
Meaning to say that there are a lot of people wanting to communicate with the experts that we place in a crisis hotline that actually were mostly due to anxiety and depression because of the quarantine lockdown that has been going on.
During today's Senate hearing on COVID-19 crisis, the center reports that some of the recent callers are repatriated OFWs. Frontliners exposed to COVID-19 patients are also being monitored by the Health Department.
Tawag na natin silang modern-day heroes. Pero pagdating naman dito po ay nakukulong sila at hirap na hirap po ang kanilang kalagayan.
Hence, amendments to the Mental Health Act was sought as proposed by Senator Sonny Angara. His bill states there should be higher compensation for people suffering from mental health problems due to work. PhilHealth must also increase its case rates for Filipinos undergoing treatment due to mental health issues. Currently, it allots 7,800 pesos per member for such cases. Different stakeholders, including the Health Department, support proposed measure.
So on the uptick, given the number of people cooped up or quarantined, baka panahon na po na gumawa ng separate case rates for different cases.
Health Secretary Francisco Duque III said they will review this on the third quarter of the year.
Ibigyan din ko po sa PhilHealth bilang chairman of the board na kinakailangan talagang i-review na ito at kung pwedeng ma-ramp up ang support value ng PhilHealth sa mga iba't ibang mga kondisyon na nakaka-apekto po doon sa mental health ng ating mga kababayan.
For News 5, Mean Los Baños, we are One News.
We'll pause for a short break, but when the big story returns, 2 areas in Leyte each record their first ever coronavirus case after the government launched its Balik Probinsya program. And the Education Department stressed it will not allow face-to-face learning in classrooms for this year's school opening. Keep it here on One News for more big stories.
It's the National Flag Day. We commemorate the first time the national emblem was unfurled on this day in 1898. It was after the Philippine Revolutionary Army's historic victory against the Spanish forces at the Battle of Alapan in Imus, Cavite. Do you still remember the meaning behind the national flag symbols? Here's a quick refresher. The 3 stars represent the country's major island groups, Luzon, Visayas, and Mindanao. The 8 rays and the golden sun, meanwhile, represent the 8 provinces that first revolted against Spain. These are Manila, Bulacan, Cavite, Pampanga, Morong or modern-day Rizal, Laguna, Batangas, and Nueva Ecija. The white portion in the flag represents liberty, equality, and fraternity. The blue one symbolizes peace, freedom, and justice. And the red one means courage and patriotism. The Philippine flag is also the only national flag in the world that signifies a different meaning depending on its orientation. If it is in standard form, where the blue portion is on top or at the observer's left side when hung vertically, the country is at peace. But if the red portion is on top or at the observer's left side, the country is at war.